Well, we're going to begin today with one Hollywood housewife's real-life battle with the debilitating disease. Yolanda Foster, one of the stars of the hit TV show The Real Housewives of Beverly Hills, she's been suffering from Lyme disease for 2 years, and she's now undergoing experimental stem cell treatment in Germany, hoping it will lead a cure. Here she is talking about her conditions on Fox and Friends after she was first diagnosed.
I was struggling for about 2 years before I finally was diagnosed, and it started with, losing my brain function, like not recognizing people, not being able to pull, words and memory. I always thought I had an infection in my brain, and I kept saying to the doctor, there's something going on in my brain, and they, started giving me antidepressants and Ritalin and Adderall and all those kind of things.
Okay, so Dr. Samadi, I start with you on this. I mean, Yolanda can go to Germany. She can go for stem cell treatment. What is the treatment? I know someone personally who has Lyme disease, and it just seems to be a recurring battle with fatigue and all the symptoms. I mean, so what's the treatment? How do you prevent getting those, because it's coming from the ticks mainly, right? I mean, There's so much to talk about. You tell us everything.
So as you mentioned, it comes from deer tick, and we know about this disease since 1970s. So there's a lot of questions that's unanswered. It's basically the tick gets attached to the skin and sucks the blood and enters this bacteria, Borrelia burgdorferi, that's what the name is. And then soon you would get the rash, the bullseye rash, you would get the fever, fatigue, and all of that. If you treat it early on with 2 weeks of antibiotics, it's gone, it's done deal, and it's finished. A lot of times, as you mentioned, you may actually get the bite and you don't know about it. And in her case, this has been going on for about 2 years. So once it becomes a chronic Lyme disease, and this is a lot of debate among all the doctors, it's a little controversial because we don't really understand it well, then it becomes a problem. It can affect your nervous system, can affect your heart, the joints, and everything else. Problem with the patients is that they are very frustrated. They go to one doctor, they say you have chronic fatigue. Another one says lupus. Someone says MS. Somebody says it's all psychosomatic and you're crazy or you're nuts and it's all psychotic issues. And that's where it becomes desperate. Obviously, it has affected her. Now, talk about treatments. Prolonged antibiotic doesn't really help. Stem cell is investigational. Going to Germany, I hope she gets better. It may help some of the neurologic issues, but I'm not convinced that it's a way to go. Best way is prevention, which Mark will talk about.
Wait, prevention is the key, but you still aren't telling me what to happen. Dr. C, you can pick up your...
So let me just finish up the thoughts that sometimes, not to jump in Mark's, but sometimes besides this, there could be another parasites called Babesia. You have to see the experts in Lyme disease. Everybody is concerned about the Lyme disease, but there could be other parasitic disease alongside that you should be thinking about.
The first point is, absolutely, David, agree with that, because that's another burgeoning problem, babiosis. The problem is, where do you live? If you live in the Northeast, the Midwest, or upper Midwest, like Minnesota area, or now California and Oregon, in that area, it's a burgeoning problem, over 300,000 cases a year. Ticks are all over the place. First thing you have to know out there is the tick has to be on you for about 36 hours or more. It's got to fill up. So if your tick is not filling up with your blood, you probably don't have Lyme disease. You can also get that tick tested. If you save the tick, bring it in and get it tested. The bullseye rash David was talking about, and literally it looks like a bullseye. It's got a center of red, a halo around it, and then another ring of red around that.
Does the tick have to be there to see that bullseye?
No, absolutely not. The tick may disappear, it may fall off. And by the way, where you look for it, Eric, is in the scalp a lot of times. Wow. Look all over the skin. When you've been out in the woods or something like that, near where there's tall grass, you look for this tick. Bullseye rash only found 60% of the time. So if you start having fatigue, joint aches, and fever, and muscle aches, and you have lymph node swelling, you live in an area like this, you think Lyme disease. I have to diagnose it early. If I get you that antibiotic, usually doxycycline, amoxicillin, or Ceftin early, I can cure it most of the time.
Okay,
I think this is important, Arthel.
But I have a question the viewers are going to be asking. Okay. So if you see this bullseye rash, that's for sure you have Lyme disease.
Not 100%, but you have to get treated, because when you treat it with 2 weeks of antibiotics, and at that time, he may not have the right antibodies in the blood, so there's a blood test that may show up and become positive 3 weeks, 4 weeks. You don't want to wait. So if you see it, treat it. The other thing is that if you see the tick, you don't want to just basically pull it up. You want to make sure that you use a tweezer and very gently pull up and take that to the lab and make sure that they know what it...
Put the tick in a baggie, right? And bring it. That's right. We used to do a tick check on our son years ago. Then you forget about it. And you get lazy and totally forget.
I want to talk about this blood test for a second. It's really important. It too is only about 60 or 70% accurate. So in other words, you could have a negative blood test and still have Lyme. The worst problem, and this is how we get into cases like this celebrity, the worst problem, I call reality TV a celebrity. The worst problem is that these titers stay positive. So once you have Lyme disease, even if you're cured, the antibodies stay positive in your blood, and you think you still have
What do you do? So wait. The antibodies stay positive. Does that mean you still have it, or you think you have it? What's the difference?
Well, you may still have it. That's why 15 to 20% of the time, Arthel, I can't treat you successfully. The later you come to me, the more I may not be able to treat you. So there is something called chronic Lyme. She may have that, but the long-term antibiotics may get rid of it and may not. Something like stem cell treatment's completely unproven. It is not proven. The goal there is to boost the immune system, but they may not get rid of it.
You know what gets me about this whole thing? Can I just say one thing quickly? She said in our soundbite, it took her 2 years. Just go to the doctor. Took her 2 years for them to diagnose this. What is your message now as it begins summer to doctors, to people who may have these symptoms and think, I'm tired, I can't think, I'm forgetting stuff, and no one thinks it's Lyme disease?
Well, number one, wear long sleeves when you come back from being out there. Inspect the entire body, including your hair and your pets. If your child or yourself have this tick, make sure you very gently take it off. Don't panic. Take 2 weeks of amoxicillin or antibiotics and get tested, and you wait for that. In her case, this is a severe case that has affected neurologically to the point that she couldn't remember what to say or how to talk, etc. There are some case studies, and we don't know yet because this is not approved in US, that stem cell can lower some of the symptoms of her neurologic disease, and obviously we wish her luck. Not everybody can afford this. It's about $40,000.
I want to emphasize a point David just made. If I have a doubt, I treat. To answer your question, Eric, somebody comes to me with fatigue, it's the season, they got muscle aches, with or without the rash, you've been near a tick, I would treat.
I think the biggest
because why not give 2 weeks of antibiotics?
The biggest thing, Mark, is to see experts for Lyme disease. It's a lot more complex. It's underreported. We used to think that it's only 30,000, and now it's about 300,000, and this is growing rapidly. It's not so much that it's epidemic. We are starting to detect and understand it better, and there's a lot more questions to be answered.
If you have chronic Lyme disease, are you kind of SOL?
The problem is there's a lot of so-called experts out there, and I don't want to give anyone a bad name, but there's a lot of quacks out there that are making a lot of money off of people worrying they have chronic Lyme and given unproven treatments. Before you go to see someone like that, you should see an expert, as David mentions. A rheumatologist, an infectious disease expert, someone with a lot of experience.
Huge overlap. If I just ask him, like, well, how do I know I don't have lupus? Or how do I know I don't have ALS or MS? Chronic fatigue, sometimes they call them Crohn's disease. All of these autoimmune problems, long-term chronic Lyme, they think mostly it's autoimmune, not the initial tick bite. Over time, your immune works against you, and it's very difficult.
Well, what I take out of this is if you have some of these conditions, we're getting into the summer now, think Lyme disease and tell your doctor.
You bet.
Absolutely.
Or just come for grill to our house and we give rid of all the ticks.
No ticks at David's. I get rid of all of them, so you're okay.
Coming up, we're going to talk about something else.